Ambulance service, is the patient breathing? Is she conscious? So tell me exactly what's happened. What's the full address of the emergency? Just got to ask you a few questions, but it's not going to delay any help.
Part of the roles of the clinical assessment team is to do what we call hear and treat and see and treat. See and treat is predominantly ambulance crews going out and doing that face-to-face assessment, because that's your nature of actually seeing it, physically getting your eyes onto that patient to say this is what we need to be doing with it.
What's your name again? Jan. I'm Grace, okay? I know it's worrying, I know it's scary, okay?
The call that we're currently dealing with is a lady who came through to air screen as potential choking, difficulty in breathing. As we got there and assessed the lady, we realised it wasn't a choking, it was a case of she was having some difficulty in breathing following eating food, and she was having concerns and worries about that, which was increasing her respiratory.
Yeah. Okay. Yeah.
We calmed the lady down and I started monitoring her oxygen levels, had to listen to her air entry, made sure everything physiologically was fine with the lady. So once we calmed her down and got our symptoms under control, we could start to treat or consider our treatment pathways for the underlying condition.
Came through as choking, you proper frightened us.
Hear and treat is predominantly having a discussion with the patient, doing a clinical assessment and determining the need for that patient's requirements. Now that might not necessarily mean going to an emergency department or travelling by ambulance.
I'm just going to do a quick assessment with you. Can you tell me what the problem is today?
We have a range of functions available and a range of different referral pathways which will allow us to correctly determine the correct pathway for the patient. Now that might be physio, GP, district nurse, falls referral or anything of that nature.
Ambulance services are changing. They're no longer just about taking you to a hospital. They're about providing good care, quality treatment, no matter where you may be. Sometimes over the phone, sometimes in person. Ambulance services have dedicated clinicians who will respond in the community and provide treatment close to or in a patient's home. They may not transport you to hospital. They might transport you to a different location, such as an urgent treatment centre or a minor injuries unit, or they might treat you and discharge you from the scene if that's appropriate at that time. Ambulance clinicians are working hard to provide the best treatment to patients wherever they may be and whatever their problems are, be that physical or mental health.